Hi everybody, I'm Dr. Joseph Cipriano, and today we're at Lake Bowen over in South Carolina, Spartanburg area. And today we have our patient, big guy actually. He's 6'4", about 220, 230 pounds. He does commercial glass is what he installs for a living, so he's a lot of times lifting a lot of big heavy pieces of glass. He's been having low back issues, and then also in his spare time, obviously with being that tall, plays a lot of basketball, and told me that he does roll his ankles quite a bit. So some of the things that I really want to check out are that low back and the hips and pelvis, just to see if if everything is level or if it is unbalanced. So did I kind of hit everything on that?
Yeah, pretty much.
Pretty much?
Yeah.
Okay, all right, so yeah, those are the chief complaints. So what we're going to be doing, we're going to go through and do a full spine adjustment today. We'll go through the muscle test, we're going to look at the leg lengths, and we're going to see kind of how his body's reacting and what's going on today. So what I'm going to have you do, I'm going to have you lay face down for me. Yep. Alrighty. I'm just gonna move the hat. Okay. So what I'm doing right here, I'm just going through and feeling kind of the muscle differentiation. I'm feeling for tight muscles, and I'm checking bilaterally, seeing if both sides of tonicity is feeling the same throughout. In the upper thoracic area, kind of to the base of the cervical spine, I'm definitely getting more tightness all on this left hand side. So we're definitely going to be making that first adjustment right up here, especially on the left. We're going to go through and we're going to scroll down through the spine here. And also I'm feeling for any type of divots or bumps almost in the spine. I'm feeling that tonicity, checking everything bilaterally. And there's definitely a few areas right through the mid back that guaranteed with pushing on, he's noticing. I know he's just kind of staying quiet there, but he's feeling these little areas. These we're going to be getting corrected all day. So when coming down to the low back here, so this is the area of his chief complaint. Yeah. So you got to realize, he's lifting large pieces of glass. How heavy would you say some of the glass is that you're lifting?
Like 100, 150 pounds.
100 to 150 pounds. So as you can tell, those are big pieces of glass, and with doing that day in, day out, you can definitely be causing some issues if you're not lifting that glass properly. So if you want to come down, we're going to check the leg length on the patient here. So as you can tell, you see how much shorter that left leg is here compared to that right? Quite a bit shorter. So this is going to be one of the issues, especially that patient stated in his free time likes to play basketball. Obviously, 6'4", would imagine he'd be playing basketball, but he's been rolling his ankles quite a bit too. So that can easily be one of the issues that's causing him to roll those ankles, because his hips are, as you can tell, are unbalanced. So let's balance out the hips, correct the spine. We'll get the leg length being back to normal, how it should be. So let's start up here at the top. Like I said, so we got T1 on the left is going to be that first adjustment. There we go. That moved really well there. There it was. Perfect. All right, let's go through and clear on a little bit of the thoracic. We're going to do a prone thoracic adjustment in the beginning, and then I'm going to actually have you flip over, and we're going to do an anterior thoracic as well. So I'm going to have you take a deep breath in and exhale all the way out for me. Got a lot of movement right there. I'm going to do one more time with that, okay? Deep breath in and let it out. Okay. All right, now here we're going down to that lower back. This is going to be that main chief complaint area. So we're feeling a little bit more issues on that left SI joint. So that's going to be what we're going to focus on. As you can tell with the leg length here, we're seeing that left short leg. And as I'm feeling when palpating, he's having some edema, which is basically an inflammation in that left SI joint. So what I'm gonna have you do, I'm gonna have you lay on your side and face me, please.
Like this?
Yep, just like that. I'm gonna have you bend the top leg, keep the bottom one straight. Good. Give me this in. Bring that around. Good, and just relax. There we go. Actually, that moved quite a bit.
Yeah.
Lay flat on your back.
Okay.
Legs straight. So what I'm gonna do here, that he's been having the ankle issues, I just want to go through. I'm gonna remove your shoes for you. Okay. We're gonna do some ankle adjustments as well. Just because you have been rolling those ankles, I just want to make sure everything is where it needs to be here. There we go. One more. Good. Oh, good. There we go. Got a lot of movement in the ankles there. All right, I want you to lay on your side and face me now. We're gonna bend that top knee. Good. Roll over. Yep, just like that. Good. Good. Okay. So I want you to lay back face down for me this time. I want to recheck your leg length here. So now if you come in and look, those are almost 100% balanced, as before they were completely off. That left side here used to be a lot shorter than it was. So just right there, as you can really tell, that left SI joint had a lot of issues that we just took on with that adjustment. I know he felt that move quite a bit there also. What we're gonna do, we're gonna be doing the anterior thoracic spine. I just wanna make sure that I cleared this down completely. So I'm gonna have you sit up at the edge of the table for me. Yep. I'm gonna have you cross your arms, just like that. So what I'm gonna be doing, I'm gonna have you take a deep breath in. Okay. I'm gonna start bringing you down on the table. As I bring you down, I want you to exhale all the way out for me, okay? So deep breath in, and exhale out. Oh. There we go. That cleared out the rest right through that one. All right, good. So let's go ahead now. We're gonna check your cervical spine just a little bit. I wanna see how you're rotating. We're gonna turn your head. Look as far as you can to this side for me. Come around the front if you want. All right, do that without turning your chest. So look as far as you can to that side for me. Good. Now look as far as you can to this side for me. Do you notice that you can't turn your head?
More to the left?
Yep, more to, exactly. So we're gonna do this adjustment to get your head rotating a little bit more to this side, okay? So what I want you to do, bring that ear to that shoulder. Okay. Good. We're gonna come in. Oh. Good, good. Lay down on your back. Yeah, as you can tell, so he's a little bit stiff, but you know what? It's been quite some time since he's been adjusted here, so I'm gonna have you drop this shoulder. Good. Good. All right, stay just like that for me. So what we're going to be doing here is we're going to be using what's called a Y-axis distraction. So there's a lot of pressure in between the spine, there's a lot of pressure being put on the nerves from the spine. And what we're going to be doing with this Y strap, we're going to be opening up and taking the pressure off the nerves in that spine. We're putting that right around the base of your neck, just going right around that occiput here. So relax. So now what I'm going to be doing, I'm going to be pulling from a Y-axis distraction here so we can take the pressure off those nerves. So we're going to get in, we're going to bring him to tension. Ooh. Boom. And right there.
Yeah, I felt that.
Right there. See, that turns the power back on, taking the pressure off those nerves. All right, so what we're gonna do, if you wanna come back around, I'm gonna have you look over each shoulder again, and we're gonna see exactly how the rotation is going in your neck. So I'm gonna have you look as far as you can to that side. Good. And now also I want you to turn your head to this side. Tiny bit further, getting a little bit more movement, but not much. So this is gonna be, we're gonna have to be working on this area a little bit more often. So I know it was not his chief complaint up in the neck, but we're gonna be also finding more of a secondary condition. So he may not be feeling any type of pain in the neck, but as chiropractors know, pain is not the first symptom that people have. So as of right now, we can see the decreased motion when rotating his head left and right. So on our next video with this patient, we're going to be focusing up on the cervical spine here and really getting more motion in here. Today we did get that low back and the hips. We got those realigned. So now hopefully we can stabilize the ankles as well. Now after clearing out the cervical spine, the thoracic spine, the lumbar spine, and the hips and pelvis, we're going to be focusing on a soft tissue technique that we know he does a lot of heavy lifting, you know, with the glass, 100 to 150 pounds. He's definitely going to be having some positive indicators with the soft tissue muscle group in here. So what we're going to be doing, we're going to be doing a trigger point therapy, and it may be a little bit painful, but it's definitely something that you're going to need. This goes hand in hand along with the chiropractic adjustment. This is going to help his body hold the adjustment that was just made a little bit longer. So what I'm going to first have you do, we're going to bring that, actually take your hand here and put it in the small of your back for me. Yep, other way, like with the back, okay. Just like that, perfect. So with that, what that does is it opens up the scapula, gets a lot easier for me to be able to get in here without him fighting me. So we're gonna come in underneath the scapula. As you can tell, I'm gonna take my thumb, literally drive it right in here. I'm gonna hold up to 5 seconds. 3, 4, 5. Okay, we're gonna go up. 1, 2, 3, 4, 5. Gonna relax. How's that feeling for you? Pressure all right there? Yeah. Okay. So we're gonna go a little bit higher and down. 1, 2, 3, 4, 5. How's that feeling? Okay. So as you can tell, so we're really following a lot of the trapezius muscle, and we're starting on the left side, and then we'll go over to the right side and hit the right side. So as I'm coming in, we're really getting a lot of these knots pushed down here. Yeah, he's feeling this. If you're coming around to the front, you could probably see a little facial expressions of what I'm doing here. Good, good, good. Let me come around to the other side.
Should we do the same thing?
Yep, same thing. Hand behind the small of the back. Good. And as you can tell, what I do, I stabilize on the shoulder, bring my thumb in, up and around into that scapula, really open that up here. So we really want those adjustments to hold a lot longer, and this is really going to help with the muscles. How's that feeling? How's the pressure? Good? Okay, you can relax your arm. Okay, so we're finishing off those points in that upper thoracic, following the trap. So this technique, there we go. See, it wasn't too bad.
Yeah, it was alright.
That technique, it's kind of one of those, as I said before, a little bit of pain is pleasure. So I'm really digging into the muscles, finding those knots in the, those tender areas, and really trying to work them out. So now the reason doing that, like I said, is after clearing out the spine, we want that adjustment to start holding longer. So there we go. That was the trigger point therapy, and I'm Dr. Joseph Cipriano. Like and subscribe.